So thanks for joining. I think we'll get started here. So this is a nice webinar on the Masterclass in Adhesives. So covering a lot of common questions, care and management of your adhesive, getting started. So just to introduce myself, I'm Jack. I'm one of the ATOS Care nurses in the North West and North Wales. And I'm joined by Lacey. Do you want to introduce
Hi.
yourself?
Hello, I'm Lacey. I'm one of the ATOS head and neck nurses for London and East Anglia.
So just a quick disclaimer before we go on. This is a corporate presentation from ATOS Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication, guide, warranty or guarantee. Nothing in this presentation can substitute from individual advice or guidance from a qualified healthcare professional. Any testimonials relate to how one individual has experienced the use of Provox products, and not every person will get the same results. And just a little bit of housekeeping. For the webinar, people's cameras and microphones will be switched off. But if you have any questions, please use the chat box, and we will try and answer these at the end of the webinar or as we go along. And if you see at the top of your screen, there's the little chat button that you can click to open the chat box. Over to Lacey. I think we're having some technical difficulties from Lacey's side. So while she sorts those out, I'll just go through the little agenda for today. So we're going to look at what an adhesive is and what the purpose of them are, along with the different types that there are, the different materials, and why you might choose those over alternatives. We'll look at the different layers of the skin and what types of skin irritation there are, and why you might be experiencing those, and how to combat them and maybe reduce those happening. We'll look at some skin-friendly cleaning routines to improve your current regime and reduce skin irritation. And there'll be an opportunity, as we said, to ask questions at the end, and a few troubleshooting hints and tips. So please feel free to pop your questions in the chats throughout, and we'll get to those at the end. So what is an adhesive? So next slide, please. An adhesive is there to provide an airtight seal around your tracheostoma, often leading to improved voicing. They can also protect your stoma by reducing any bacteria, dust, air particles from entering around your stoma that would usually bypass your HME. It allows you to have flexibility when it comes to housing your HME as well. Without an adhesive, you'd either have to wear a Larry button or a Larry tube with a necktie to benefit from the HMEs. This gives you more flexibility around choosing what may be best for you and your needs, as well as what fits with your lifestyle. There are many different shapes, sizes, brands, materials of adhesives, each having different features that may suit your needs better than alternative ones. It's never a one-size-fits-all approach, and what works really well for you might not work for other people. So it's about exploring what options are out there and having that knowledge available to look at what's available. And later on, we'll look at a little guide as well, about to help you select the right one for you. So as we've just discussed, the benefits of using an adhesive over maybe a Larry button or tube or nothing at all. are the seal that it produces, protecting your airways from dust, dust and pollens, and giving you improved humidification, because all of the air is passing through that HME, helping to reduce coughing and mucus. People also report that there's often more comfortable, a really comfortable way of housing the HME. If at any point in your journey you'd like to try wearing an adhesive, I'd really recommend talking to your clinician at the hospital or ATOS Care Best Start or field nurse, who'd be able to advise you on the next steps for this. So the Provox Life range of adhesives are available in a variety of shapes, sizes, and materials based on your needs. These adhesives are a clover-shaped design, and that really allows you to do an individual fit to your stoma. Your stoma, sorry. Each of the little leaves of the clover can fold individually, which helps you to really massage it into the contours of your skin, especially for those uneven or tricky stomas. So they also come in a range of different materials, from acrylics, hydrocolloids, hydrogels, which we'll explore a little bit later. In a recent survey, 89% of individuals reported preferring the Provox Life adhesive over their previous one, and that was over 12 weeks. So you can see that there's different things available. Often people found that they lasted longer, with 65% reduction in blow through over time. So the Provox Life standard and stability have also got increased glue compared to their predecessors. This reduces the amount of mucus and air moving underneath the adhesive, creating an airtight seal, and around the stoma for speaking and your everyday fit.
Excellent. I really hope you're able to hear me now. I'm going to talk you through what a hydrocolloid, a hydrogel, and an acrylic adhesive is, and why you would choose one rather than the other. So a hydrocolloid adhesive were first introduced in wound care in the 1980s. They quickly became one of the most widely used wound dressings. They're made out of two layers. The outer layer forms a seal that keeps the area clean and protected. The inner layer creates a moist environment that supports healthy skin. The soft gel's texture also stops sensitive or irritated skin from being stripped during the removal process, so you shouldn't inadvertently damage your skin further. It's considered a hypoallergenic material, which is why it's designed for sensitive skin, although we will discuss patch testing later in this webinar. Hydrocolloid adhesives, such as the Provox Life Sensitive, as I said, are suitable for sensitive skin. Dependent on clinical suitability, continued tolerance, and careful review by your clinician, it can be used post-operatively and during and after radiotherapy. We'll discuss the hydrogel adhesive now. So you might recognise the packaging there for anyone that's on the Provox Life range. This is, in our range, this is the Night adhesive. So hydrogels for wound care have been used for over 60 years, so there's a long history of its benefit, particularly for people with burns injuries, actually. Hydrogel is a synthetic gel-based medical product with a very, very high water content. They provide extra moisture to the skin to promote more efficient repair of the epidermis, which is the outermost layer of the skin, and promote the removal of excess dead tissue and growth of new healed skin. Hydrogels have a marked cooling and soothing effect on the skin, which is valuable in burns and in painful wounds, making it ideal for irritated peristomal skin. Hydrogel adhesives are great at hydrating the skin and locking in moisture. Hydrogel adhesives such as Provox Life Night allow your skin to recover during the nighttime, although it is important to note that it's not particularly optimal for voicing, as the adhesive seal is quite weak. Lastly, we'll look at the acrylic adhesive. These are semi-permeable materials, so you might have noticed the little sort of indents over the top of the standard adhesive. Its main advantages is that it is easily conformable around body shape, so particularly that peristomal area that can be quite uneven. It's really easy to get a nice good seal using one of these. It does allow for some moisture evaporation, so if you are prone to getting quite hot, it does allow some breathability underneath that dressing. It creates a brilliant barrier for any of the bacteria and water to get in, but obviously it is not ideal for infected wounds. So if your wound's already infected, then we definitely wouldn't recommend having a standard adhesive on, and it can sometimes damage the fragile skin around a very fragile peristomal area. So we might suggest a different adhesive in those scenarios. It is always important to note that the individual components of adhesives, you can check your IFU booklet, which is that huge tree-like material you get in each box. If you don't feel like you're up for reading all the way through there, then you can also speak to your customer care representative, best start nurse or field nurse about what is in your adhesive.
So we just thought we'd have a little pause here and have a little poll. So what adhesives do you currently use, if you're using adhesives at all? So a little poll should have popped up on your screen. So we've got, do you use an adhesive? Yes, no, occasionally. And then we've got a little section afterwards, the second question, about what adhesive you're using, whether that's the Provox Life Standard, Sensitive, Stability, Nights, something from the Provox range. So that would be the Optiderm, Flexiderm, or something completely different, a different adhesive. So it's always interesting to see who's using what and how you're getting on with it. I'll give you a few moments just to go through what you're doing. And if anyone's having any problems, just pop in the chat, because sometimes Teams doesn't put up the poll automatically. So just let us know if you're having any issues. So if you look at the top of your screen, so you've got on the right, you've got the leave button. Don't click that. But then moving left, you've got a little button that says polls. So that should bring up the poll for you. If you're still having trouble and it's not popping up.
David, have you got a question? Okay, let's move on from the poll. We will skip past it. I think Jack's going to introduce the Provox Life adhesives.
Yes. Yeah. So there's a few different ones in the range. First off, we'll start with the standards. So this is an adhesive for everyday use. It's soft, flexible, and has a really low profile as an adhesive. It provides a strong seal and secure fit around your stoma. So ideal for flat stomas and if you're voicing as well. Like with all of the Provox Life adhesives, it's a clover fit, and you can see the little indents and on the picture that look a bit like a clover leaf. This allows you to really mould the base plate to your stoma and individually smooth these down, getting an improved fit. It comes in 3 different sizes. You've got the round, which is the smallest one, oval, and plus size, which is the largest, for different shapes and sizes. So the increased adhesive coating compared to the Provox range supports it sticking to your skin for longer, improving the lifespan of the adhesive and less blow through. As with all of the Provox Life adhesives that we'll talk about, the standard utilizes a secure fit coupling. So when you click the HME into the adhesive and you hear that click, you know that's securely in and reduces the risk of the HME falling out, especially if you're coughing. Which brings us on to the sensitive adhesive. And as you can see, as from the name suggests, it's a really gentle everyday adhesive designed for sensitive skin. It creates a really comfortable, gentle and low profile seal, and it's actually 35% thinner than the Optiderm in the Provox range, if anyone's previously tried that before. It's made from a hydrocolloid, which Lacey was explaining earlier, which forms a really good seal, but also really kind environment for your skin. It also promotes the healing and soothing from these properties. It is really gentle to remove with the adhesive remover wipes, just helping to lift it off. And like with the standards, it comes with 3 different sizes, the small, medium and large, to fit your needs. Then you have the stability, which is a firm everyday adhesive that provides solidity and a real stable base to help with your voicing. If you're using hands-free or you have a voice prosthesis, it can be really handy because it gives you extra support with the firm bar in the middle to increase the life of your adhesive. Like with all adhesives, you can choose the orientation of it. So if you see in the middle of the adhesive, you've got the stabilizing bar. You can wear that vertically, horizontally, or even diagonally, whichever angle fits best to your stoma. And then the final one in the Provox Life range, you've got the night adhesive, and this is the hydrogel that Lacey was talking about. So it's very skin friendly, soothes and cools the skin, especially if you've got a bit of irritation or dry skin. The hydrogel has the highest water content of all of the adhesives, allowing your skin to rest and recover. Despite the name though, some people wear this throughout the day as their day and night adhesive if they've got very sensitive skin. But there's a couple of differences which we'll talk about the application and removal of this one, as you don't need adhesive remover to take it off. Just a little point to note though, it's not suitable for everyone. And if you find that you've got quite a warm, moist neck, or if you quite sweat quite a bit, or especially in summer, it may start to lift off before you finished using it. So it's important to be mindful of this, as well as if you wear it in the day and the nights, just be careful, because if you're showering in that really warm, moist environment, it may start to lift. So it's just something to be very mindful of and to monitor whilst you're using it. But there are special adhesive strips you can use with it if you do need to wear it in the shower as well. So with keeping in mind that everyone's stoma is a different shape and size, there's several, well, there's a whole range of adhesives for that very reason. Above, you'll see the Provox range in this image, and below are the Provox Life alternatives. So the Flexiderm would translate to the standard adhesive in the Provox Life range, the Optiderm to the sensitive, and so on. So it's what works for some people may not work for others. And if you found an adhesive that works for you, that's brilliant. The ATOS Care nursing team, so the Best Start nurses and the field nurses, along with your clinician, are always happy to support with them helping you select the right adhesive for you. Alternatively, it may be something that you try a few different ones over a period of time, and something that changes as you move through your journey. So, unlike the Provox range, where you have the Luna base plate and HME, all of the Provox Life range fits with each other. So if you have a day adhesive that you want to wear at night, you can wear your daytime HME and then put on the night HME. So all of the HMEs are interchangeable with all of the adhesives. So if you just use one adhesive, you can use all of the HMEs. If you use different adhesives, you can still use all of the HMEs. So it really fits to your routine depending on what you need individually. I think we're just going to hand back over to Lacey to introduce the next poll.
Well, should we try this again? We do have a poll here for causes of skin irritation. So have you ever had skin irritation? Your options should be frequently, regularly, sometimes, rarely, never, or worst case scenario is all the time. If you are unable to see the poll results, maybe you could just pop in the chat if you do experience or have ever experienced skin irritation.
So it looks like we've got a real mix, doesn't it? Some regular skin irritation and some rare and never, which is lovely to hear. But hopefully, if we looking at routine, maybe we'll get people that are experiencing regular irritation. Maybe hopefully we might improve that a little bit.
Okay. So the function of the skin is to provide a barrier as to maintain your interior environment of your body. That includes moisture and temperature. It's the largest organ in the body, so it's very important that it's well cared for, because it provides a really, really important job. Healthy skin is replaced every 28 days, and cells move from the bottom to the top of the epidermis, as seen in the picture, and then are shed away from the body. When the skin is irritated, this protection created by the barrier against bacteria and viruses may be lost, and it leaves you open to infection as well as discomfort. So why does the skin get irritated? We're going to look at the causes of skin irritation now. So you can see some nasty looking pictures here. Hopefully nobody's experienced things like this, but if you have, you may recognise it. So now that we know how the skin is made up, let's look at the causes of skin irritation. The first picture on the left-hand side shows mechanical skin stripping. This is something that I often see when I'm asked to review a person who needs some help with troubleshooting. I typically find that this is caused when the removal process is a little bit rushed, or adhesive remover is not utilised as well as possible, or maybe not at all. Like most things in life, we try and speed things up or remove steps to make things a little bit, or seemingly make things easier. But it is really important to follow the correct skincare routine at all times. And that's to avoid problems like this. Using multiple adhesive removers to remove base plates is also recommended, rather than tugging or pulling at one that remains well stuck. The second picture shows maceration. Maceration is when the skin softens and breaks down, often becoming wrinkly or usually changing colour due to prolonged exposure to moisture. It's caused by excessive amounts of fluid remaining in contact with the skin for extended periods. Macerated skin usually appears soggy, and it's more susceptible to bacterial or fungal infections. Most of the time it goes away quickly once your skin has had a chance to dry out. However, prolonged exposure to moisture can make it more difficult for macerated skin to return to normal. Even once the skin remains vulnerable, even once the skin is dry, it remains vulnerable to fungal infections until completely healed over the surface. The third picture is a really good picture of contact dermatitis, which is a type of eczema triggered by contact with a particular substance. It causes the skin to become itchy, blistered, dry and cracked. Like in people with lighter skin tones, it typically becomes quite red, and people with darker skin tones, it can become dark brown, purple, or even grey. The reaction is caused, or usually occurs within a few hours of exposure to the irritant or allergen. Once the irritant or allergen has been removed, symptoms normally improve or clear up completely. The last one is yeast or fungal infections. So many people with a voice prosthesis will be aware of the ever-present risk of thrush. But what you may not be aware of is that you can also get candida, which is the thrush, on the surface of the skin. So the peristomal skin is the ideal environment for thrush to thrive. If you're immunocompromised, if you have diabetes, you're going to be at increased risk of this type of thing. So other skin irritants. There are plenty of other causes of skin irritation, such as hot weather. Warm, damp skin from sweat is not always conducive to healthy skin and can cause both damage and irritation if not cleaned and dried properly. As we age, our skin naturally becomes less elastic. So this means that applying and removing adhesives is a lot trickier and can cause irritation. As I touched on previously, there are person-specific factors that may mean you're more prone to experiencing skin irritation, in much the same way that people may experience red and runny nose with hay fever. This can also impact on the peristomal area. If you're having immunotherapy, you may develop skin complaints such as rashes, skin redness, or itching. As with all of these conditions, if you experience any of them, it is imperative that you speak to your clinician and get expert guidance on how to manage and treat it. So we're going to look at finding a skin-friendly routine. We'll look at the application, removal process, and any common mistakes. So before you start using any kind of new adhesive for the first time, it's really important that you patch test. What we mean by that is you should always test an area close to your stoma. We normally suggest the side of the neck or behind the ear is as a good place to start. However, if you're still healing from surgery or you have conditions like psoriasis or eczema in and around that area, it is really important that you discuss patch testing with your clinician, your ATOS nurse, their start team, about exactly where to apply and how to do it.
So because the skin around the stoma is so delicate and sensitive, it's really important to have a really good application and removal routine to help to maintain that really healthy skin to support your daily routine. So if you're wearing adhesives already, you'll know the real importance of having an adhesive remover. So these are individually wrapped wipes that can be used to help to lift the adhesive off so that you're not pulling and stripping a layer of skin each time that you're changing your adhesive. So like Lacey showed earlier, the images of the stripping injury. So this can help to minimize that. Leaving the adhesive remover wipe folded and wiping it over the top of the adhesive a few times in a circle just to help it soak through, and then as the adhesive starts to lift, wiping it underneath to help with the lifting process. I often see a lot of people when I do a visit, they've got one perfect side of the skin and then one side's really irritated where they've got bored and taken the rest of the adhesive off that side. So taking your time is really key. Because it's the foundations to helping your adhesive stick really well. Using a cleaning towel to clean the skin of any mucus, oils, dirt around your stoma is really important as well. You can get the Provox cleaning towels, which are a handy pack of 10 wipes that are really good. They're pocket sized, or you can have them in your care bag as you go around out of the house. By creating a really clean foundation for your adhesive to stick to, you're maximizing the chances that it's going to stick well and last as long as possible. And then finally, you've got a skin barrier. And skin barrier, again, is important. It helps to create a protective barrier between the skin and the adhesive. So protecting the skin from any moisture, any mucus that might irritate it, but also helping to create a tacky feel on the skin, and that improves the way that the adhesive adheres to your skin. So here we've got a little infographic about a really good skincare routine. Here, the individuals removing their nighttime adhesive with a warm, damp towel or flannel, and help it because you don't need an adhesive remover for the nighttime one. They're then giving the skin a really good clean with the cleaning wipe and allowing it to dry first, which is a key step. Then after the skin's dried, it's important to use your skin barrier and again let the skin dry, so it's a nice dry environment to be sticking your adhesive to. Whilst it's drying, to help to get the best stickiness that you can from the adhesive, try warming it between your hands, or if you've got really cold hands, put it in a warm place for a few minutes, maybe in the windowsill if it's sunny, or underneath your armpit, just somewhere that will warm it up a little bit from out of the box. When applying the adhesive, position the hole centrally over the stoma and place it down. Once you place it down, work from the center outwards to smooth out any air bubbles, creases, right out to the sides to create a really good seal. We can also send this care tips out after the webinar by email, just so you've got a really handy step-by-step picture guide if you're new to using adhesives or if you're wanting to review your routine. Now, if you're a really visual learner, we've now got a video of the application, cleaning and removal routine. So there you have Luis applying and removing his little night adhesive. So you can see where he had his damp cloth and how he worked around the adhesive just to help to loosen it before working underneath it to remove it. So like I said before, the night adhesive is a little bit different to the standard stability and sensitive, because you don't need to use an adhesive remover because it's water-based adhesive, so is lifted by the warm moisture of the flannel. You also don't need to use skin barrier with it. So because it's very gentle on really sensitive skin, it's just a really good alternative and good choice if you experience skin irritation or just want to try something that's cooling and soothing. But like I said before, just be aware that it wouldn't be appropriate for everyone. So we've put together from what myself and Lacey see in the community, we've put together some top tips and common mistakes that we see, and sort of how to avoid these. So often people think they should only be using one adhesive remover wipe, and that's fine if you're finding that's helping to lift the adhesive enough that you're not hearing a ripping sound when you're taking it off the skin. That's fine, but often people need to use more than one wipe. Some people find that one wipe over the top and then another wipe to help to lift it whilst you're peeling it away. Try not to unfold the wipe as well. So the adhesive remover wipes come folded up in the packet. If you leave it folded up in that little square, it will last longer than if you open it fully. It'll evaporate more quickly. But have a little try with different ways, and just work out what's best for you. So don't rip off the adhesive. I think we've covered that bit. Just time and patience, that real investment in the application and removal and the skincare will really help you in the long term. So having those really good routines and really healthy skin underneath the adhesive is a real key thing to help with the adhesion and the lifespan of the adhesive. So storing all the products appropriately as well. So it might be that you've got all of your adhesives in the conservatory at the moment, and with the hot weather, if they're being stored in a too hot environment, or in the winter if they're too cold, this might affect how well they stick to your skin and how well they work. So just be aware of where you're keeping them. For many people, they have lots of skin folds as well, where they've had the surgery, things have healed, but there's some creases in the skin around the stoma. What I find helps a lot of individuals is applying the adhesive around the skin folds first, and then smoothing it out away from the skin fold. So really getting that troublesome area first, and then working outwards. For those with a deeper stoma, turning the stability either vertically, horizontally, diagonally, like we said, can really help. Just turn it whichever way fits best for you. Warming to activate the adhesive to help with the adhesion, and whilst you use the stability and the night, different to the other Robots Life adhesives because they come with 3 strips on the back of them. You've got a central strip, which we'd recommend taking off first. This gives you and the ability to really bend the adhesive and navigate it into your stoma and position it really well. And then you can peel off the either sides as well, just to really help with that positioning and that seal that it creates.
So we've had some excellent advice in the chat as well. I think we'll go through this fully afterwards, because we've got some really, really great advice, and it's really always really good to have peer-to-peer advice as well, because you guys know exactly what you're experiencing. We'll just discuss when we might need to take a break from an adhesive. Now, generally speaking, an adhesive would almost always be the best option for most people, but very occasionally there might be an opportunity where we just cannot get an adhesive to work for one particular individual, be that a temporary cause such as radiotherapy, or a more long-term problem such as an allergen. So when should we pause? If you're experiencing skin irritation, then you may want to give your skin a complete break. But during this time, we still need to consider the impact this has on your lung health. It's vitally important that we maintain the HME use. So if you're unable to use the base plate, then things like the Larry tube or the Larry button might be useful alternative and can be utilised instead. So if you are experiencing those things, please don't suffer in silence. Let someone know, let your clinician know, let your customer care representative, your best start nurse or your field nurses know, and we will talk about what is the best next steps and create a clear plan about how we're going to get you back to HMEs, decrease your coughing, let you have some uninterrupted sleep, and decrease your mucus. So we'll go to this is just a little tool to work out what base plate might work best for you. You may notice we're alternating between base plate and adhesive throughout this. Us nurses call them both things, but it's a very UK term. Apparently, they do not use the term base plates at all in Europe, so we're the only ones. But you can refer to them as either with anyone in the UK, I'm pretty sure. So the flow chart, which you can also get from us, is will tell you what is the most suitable adhesive for you. So on here you can see the nighttime is the general suggested nighttime use, but you can use any of the other adhesives at night if you've got a good seal and it's comfortable. The sensitive adhesive is as it says here, after surgery or radiotherapy. Yes, you can absolutely use that in those scenarios. If you're using a voice prosthesis, then we may need to look at something with a little bit more stabilizing behind the pressure that you'll get in the center. So something like the stability is really ideal there. You can also, there's lots of people that can use a standard, or even I've seen a sensitive being used with a voice prosthesis. So really what this flowchart is, it gives you an idea about what things typically work together, but ultimately it's very, very individualized, and we would always use a holistic approach to deciding with yourselves what is the most suitable base plate.
So there's a few things that always come up when we look at troubleshooting, and some things that we always need to consider about how to improve the lifespan and the function of the adhesive. So sometimes with people that have a deeper or tricky shaped stoma, a bigger adhesive isn't always better. Sometimes having one of the smaller sizes of the sensitive or standard Provox Life adhesives or other adhesive actually helps you create a better seal, because it can fit closer in the stoma and has less gap between the stoma and the adhesive. You don't have to change your adhesive every day, and some people do. Some people really like that and like that routine, that daily routine, but actually it's not right for everyone, and sometimes changing it more often causes some irritation. Sometimes people find that changing it less often causes a bit of irritation. So it's very individual. And what I'd say is just to keep a watch over your skin and talk to your clinician, ATOS care nurse, GP, if you're having any skin irritation, and what they'd recommend to manage this, because it's can be caused, like we've seen, by a range of things. For people who do have to wear a Larry tube for whatever reason, you can use a ringed Larry tube in all of these adhesives. So it allows you to get the benefit of the seal from wearing your adhesive, but also you can still wear the tube. So it's kind of the best of both worlds, if that's appropriate for you. It also removes the need for you to be wearing your neck bands, which I know some people find irritating in the summer, especially when it's warmer weather. So some hospitals do have a service at the prosthetics department, which can create a little mould of your stoma, and this can be really helpful if you've got an excessively deep or difficult to manage stoma. So that can help to build up and flatten the area, so you can wear an adhesive or get your tube in better. But this is something that would always be guided by your clinician at the hospital. But if you find that you can't find a product that works for you, it's always worth having that conversation and just asking, because it's not something that comes up very often, but it might be something that's available for you. And then finally, just be aware that some products, such as creams and ointments that have an oily feel, or when they dry oily, they can affect the adhesion of the adhesive. So just be wary of what you're using in conjunction with your adhesives. And some creams have ingredients that can cause irritation as well. So just be mindful of what you're using and any changes and what effect that has on your skin, just so you know what's best for you.
Okay, so in summary, we've looked at the finding your best adhesive for you and your skin. So hydrogels give the best chance of recovery whilst enabling you to continue with a HME. The hydrocolloids are a fantastic adhesive which can be used on sensitive skin. The skin-friendly change routine is really, really important. It's such an important step in maintaining your skin. We can't stress enough. I think I must talk about this multiple times a day. Making sure we slow all the steps down, and I can see that we've had some fantastic advice in the chat just about making sure that the removal process, the steps are all really, really slow and careful, and the skin is really well prepared. Removing your adhesive gently and not rushing that last bit where you just kind of want to pull it straight off. That's such an important step as well. As like Jack said, you can get one side of the stoma that is very much more sore than the other. Using the right products at the right time to avoid skin irritation. So making sure that you don't skip steps, you don't maybe move one step before another, because they are designed to work in that specific sort of flow, just to make sure that they don't interact with each other and they don't cause one to be undone. So the other really important thing is if you notice changes to your skin, if you notice irritants and a change to just how things usually are, it's really, really important not to ignore it. And you should always speak to your clinicians, speak to your field nurses, and ensure that if you're going to change products, you just do a small patch test first. And again, if you want support with that, then your field nurses can come out and see you. Or you can go into clinic and your clinicians in clinic will help you with this. Okay.
Thank you. That brings us on to the question and answers.
We definitely have got some questions in here.
We have, and that's brilliant to see. Let's just get the questions up. So Mark's asked about talking about the adhesives for Larry clips, and that's a really good question. So we'd always recommend treating the Larry clips just like an adhesive, so making sure that you're being careful to remove them using the adhesive remover, preparing the skin well, and whether that's cleaning, and then using a skin barrier wipe as well, just to aid the adhesion and help them last longer, especially when you're taking the Velcro off to take the tube out. You want those pads to be staying where you want them.
Yeah, so the first time you use Larry clips, they can be a little bit tricky. So it is quite worthwhile having, either doing it in clinic or having one of the nurses with you, just to make sure that you kind of get the hang on placement. I personally find it easiest to apply the Larry clip adhesives to the Larry button or the Larry tube, and then hold it against your skin of where is comfortable. But you can use them very off-piste, shall I say. So you might have one Larry clip that's sitting quite high and one Larry clip that's lower, that can be just as effective. And typically we would see that in someone that's very, very early post-op. We are starting to see the utilisation of Larry clips in very new post-op patients. So it's all a positive step. We're moving forward with everything, which is good.
And then we've got a couple of questions that were submitted before as well. So, where are we? So someone has written in that they have irritation from every adhesive that they've ever tried to use. Can you recommend anything? And I think this takes it back to the importance of a patch test, like Lacey was saying, having a range of options available, whether that's the sensitive, the night, whether it's one of the Provox adhesives or whichever adhesive you're choosing to use, and having a little patch test of each of those to see if any of those are appropriate for you. And also just being mindful that it might not be the adhesive, it could also be any of the wipes that you're using as well. So just being able to narrow those down, and that's something that the clinicians can help with at the hospital, or the ATOS care nurses as well.
Yeah, and we've got another comment as well. Exactly right. It is also important to make sure that you're not allergic to any of the other components. So the wipes, the barriers, the adhesive remover. So you can patch test anywhere. A lot of people patch test on their arm so that they can see it quite clearly. But obviously, just be mindful of the fact that a lot of the time your irritation is caused because the skin's already upset, and the skin's upset because you've just had surgery, you've just had radiation, everything's been pulled back together again, and that can be part of the reason why you're getting sensitivity when you never used to have it before, never been prone to it before. So that is always worthwhile testing somewhere close to the stoma without actually irritating that peristomal skin as much as possible.
Dave has just written in, when the skin is broken, should I stop using adhesives and rest the skin? And yes, once the skin's broken, it's time to have a rest and let that skin heal. And if possible, before you get to the stage where the skin is broken, finding out from your clinicians if there's anything you can do to stop you getting to that stage. But absolutely, once the skin's broken, you need to have a rest and let that skin recover.
We got an early question regarding compatibility with other brands. I believe that was regarding HMEs. So potentially you were using a Blumsinger HME, is that correct? The Provox Life range is not compatible with Blumsinger products, but the Provox range is. So obviously the Provox range, we did touch on this a little bit, that we gave you the options for the conversions, but there is the sensitive in the Provox Life range is the equivalent of the Optiderm in the Provox range. And the standard in the Provox Life is the equivalent of the Flexiderm in the Provox range. So it is absolutely possible for you to find a product within the Provox range. If you're getting on well with the current products and regimes that you're using, then I wouldn't necessarily recommend you swap at this moment. But if you do want to try something, then discuss it with your clinician and work out what's best for you.
Mm-hmm. And we've just had a question from Mohammed. Which adhesive is better for the shower, and is it important to change the adhesive every day? So it's very much about what you find works best. So you can wear all of the adhesives in the shower. Like I said, the nighttime adhesive does lift off once it's warmed and moist, so be mindful of that. But you can use the standard, the sensitive, and the stability in the shower, as long as you've got a nice good seal around it, so it's nice and sealed to the skin. And is it important to change the adhesive every day? It's very much about what works for you. So some people change it every day, because they need to, because of the skin, or because there's mucus behind the base plates. But actually, if this isn't a problem, you can leave it for a couple of days and change it then. So it's very individual.
Have any of the team today ever tried wearing the adhesives? Yes, absolutely. We have tried our products. We've tried competitor products as well, just to try and give us a bit of a better understanding about, you know, what you guys are dealing with each day. And it's really important for us to know that. So yeah, I personally have got a preference, but I don't like to sway anyone's decisions. I'm sure Jack has as well, but I keep that to myself.
Yeah. So from Ben, with the hands-free, was finding that the base plate was not strong enough, and came loose. So it might be that trying a different one might be better for you, or it might be something that talking to your clinician or ATOS care nurse might help, just to look at why that might be and any suggestions that they can make, because there's a lot of reasons with the hands-free why your adhesive might not last very long. So it's looking at a whole range of things and coming to a solution with your speech and language therapist and finding something that works for you.
Yeah, and I can see that someone's using silicone glue. Absolutely, it does work really, really well for some people, but equally, if your skin is slightly irritated, it's not necessarily a product that I would recommend. There are things like the Provox adhesive strips as well, which you can reinforce the edge of a stoma. And I think someone else mentioned that they were looking for a base plate that was slightly larger. So if you've already gone up to, say, the plus sizes and you still don't find that that is large enough for what you want, then you could utilize the Provox adhesive strips around the outside. What I will just reiterate is that I have got a lot of different people that I see who ultimately the stoma is roughly the same size for everyone, give or take a few millimeters. So the peristomal area is the bit around the outside. I know Jack mentioned this before, but bigger is not always better. That means that you might not need to go all the way out to the edge of your neck for you to achieve that really good seal. It might actually sit better to the flatter part, is often the closest part to the stoma, and that's where you might get the better seal, is if you have a smaller round base plate. So again, if you're having issues like that and you just can't quite find a shape that works well for you, then either back to your clinician and discuss it with them, or ask for a referral to the field nurses. And you can do that by speaking to your customer care team if you're past Best Start's phase. If you're still with Best Start, then you can ask them for advice, and they may send one of us out to come and see you, or one of our colleagues. But it's definitely something that we can start troubleshooting together, because it's really, really difficult to give advice without seeing. But I can say on a generic term, what works best for one person doesn't necessarily work best for the next.
Perfect.
Did anyone else have any questions left? think we were getting through most of the questions.
We've got Brian. You've popped your hand up. Do you have a question?
Brian. I'm not sure if we can call you in, Brian. No? Could you pop it in the chat, Brian? Are you able to write it down for us? Mohammed, did you want something else answered?
So if you like, Brian, you can unmute your microphone, and if you're able to, you can say your question, or if you want to type it in the chat, or if it's quite a long one, you might be able to, if you have a question, you can text your.
Can you hear me now?
We can hear you now. Yes.
Hear you.
All right.
Great.
Right. My question is I have quite a lot of mucus that sticks at the back of my throat. What do you suggest to be able to remove it without doing any damage? Because coughing does not remove all of it at all. I mean, I can still see it when I shine my torch down the stoma.
Brian, what products do you use at the moment? What adhesive do you use, and what HME?
At the moment, I'm using the one with the bar on it. The stabilizer with the bar on it.
The stability, yeah.
Mm-hmm.
Also, today I got hang on. I've got the home HME in today.
The home. Okay. So
only because I'm sitting indoors. If I was outside, I would put a different one in.
Is it the white one you use, or the red box?
I use the blue one now if I go outside.
Okay.
I find it a lot better. I breathe more easily.
Yeah, really, really good for breathing, that white energy one. But it's not very good for humidification. So it's just to make sure that wherever possible, you are achieving as much humidification as you can. So increasing the length of time that you use the home HME will help to thin out some of the secretions you're getting. It's also really important because it's a little bit warmer, or certainly is with me today. It is really important that you're maintaining your hydration, and I think that's something that none of us do particularly well. If you maintain your hydration, it will thin your secretions and will make it easier to cough up. So things like water or squash rather than teas and coffees.
Okay, I'll give it a try.
Give it a go and let us know how you get on.
Thank you.
Mohammed, you do use night adhesive, or you do not use night adhesive. Is this something that you'd like to try, Mohammed? The night adhesive isn't, you don't have to use it. Some people don't ever need to use it. But certainly if you want to cool down and soothe your skin, it is a really, really good useful adhesive to have in your arsenal. Quite often I will suggest that that people use it as and when required. So they might not need it every night, but they might need it say once a week or for a few days each month, just to settle things down again if they're a little bit prone to having a bit of a flare up. And again, some people will, if their adhesive has lasted a little bit longer than a day, they might put a night adhesive on. If they're going to have sort of a quieter day at home, they might use one then, just to sort of see them through the rest of the day, and then they'll start their skin care routine again. So although it is marketed for a nighttime use, and it's because it's not brilliant at voicing with, people can, but generally most people would have a bit of a problem with it. I think it is just to remind everyone that it is, you can use it at any point in the day, but just make sure that you're not about to go and give a webinar like this and need to do a lot of talking. Was there anything else that anyone had?
If you've ever got any questions, we're always here to support, aren't we? You've got your customer care team, the best start nurses, and your clinicians as well at the hospital. And there's plenty of these of the MyLife events as well online. So they might have some of the questions that you've got as well.
Definitely. Chris, I did answer your question about glue. The silicone glue, the Provox silicone glue, is definitely a really good option for some people. However, it's definitely a case-by-case basis that we would discuss about its suitability. So if it's something that you're interested in, or if it's something that you're already using and you're not quite sure how to use, I think we would probably discuss that with you in person, or over the phone or via email, just so that you get all the advice that you need. You can find the silicone glue in the catalogue, but if your skin is very, very prone to irritation, I would be really wary about its use. Or if you had very fragile skin from radiotherapy or just age-related fragile skin, then we'd need to use it with caution, I think. I have seen it used very, very effectively for a lot of people, particularly those who use free hands or speak free. So that is, it's definitely a worthwhile look for some people who are still having problems.
And with your question about, is there any other adhesive remover swabs to help you clean up and speed up the process between base plates, that all of the adhesive remover wipes will help with that, and they're wipes rather than sprays, because you don't want to be inhaling those sprays. So the wipes are the key with the silicone glue. Brilliant. So
yeah.
We've
Chris said, I use Provox glue to improve adhesion of my stability base plates, and it's very, very good. Is there anything other than adhesive remover swabs that I can use to speed up the cleanup process? So we answered that one, didn't we, between the both of us?
Yes. Yeah.
Fabulous.
So I think if that's, we've got, obviously you can email any questions you've got, and we can get back to you on those. I just wanted to say about some of the upcoming events that we've got coming up. So on the 3rd of August in London, we've got a screening of Can You Hear My Voice, which is a really nice documentary film that is working in partnership with the Royal London Hospital. And then on the 15th of August, we've got a How to Use Your Free Hands Flexi Voice webinar as well. So if those are things that would be interesting to you, I think they're in the What's On guides that's been sent out to you. But if you've got any questions about those, please do reach out as well with any questions.
I'll be there in London on the 3rd of August, and our lovely Alison, who is our speech and language therapist, is going to be hosting the free hands webinar as well. So that will be excellent.
Perfect. Thank you, everyone. Hope it's been helpful.
We will hopefully see you guys again. You take care.
Take care.